Hi, hello, welcome back. So today we will be seeing about incisional procedure code series 33250 to 33268. It is a topic which is coming under cardiovascular CPT part. Okay, we have added a playlist for CPT topics. Please do have a view on it. So definition for this incisional procedure is 33250 to 33268 primarily involves surgical intervention to treat arrhythmia by making precise cuts or incision in cardiac tissue. These procedures aim to interrupt abnormal electrical pathway and restore normal heart rhythm. CPT code range for this is 33250, 33251. These two are operative ablation with and without cardiopulmonary bypass. 33254 and 33255 with a maze procedure with cardiopulmonary or without cardiopulmonary. And 33256, 33258, 33259, 33261. Please read the procedure very carefully, read the description and understand why, for what purpose this procedure is being done. So you have to read each codes very carefully along with the description, then only it will be easy for you to understand while coding also. And then 33263, 33264, 33265 and 33266. 33263 is operative ablation of arrhythmogenic focus with maze procedure, coronary artery bypass and valve surgery, whereas 33264 is with maze procedure, cardiopulmonary and atrial septal defect. So example for this, first one is case of atrial fibrillation with cardiomyopathy. Here 60-year-old male patient with atrial fibrillation and cardiomyopathy. So here we are giving 33250. Then the second example is case of atrial fibrillation with mitral valve disease. A 58-year-old female patient with atrial fibrillation and mitral valve prolapse. Here the maze procedure and valve surgery is done. So we are giving 33256. Example 3, case of ventricular tachycardia. A 65-year-old male with ventricular tachycardia. Procedure done here is operative ablation without cardiopulmonary. So we are giving 33251 as a code. And then example 4, case of persistent atrial fibrillation. Here 62-year-old female with persistent atrial fibrillation. Procedure done here is operative ablation with maze procedure and coronary artery bypass. So we are giving 33258. Example 5, case of atrial fibrillation with atrial septal defect. A 55-year-old female with atrial fibrillation and atrial septal defect. The procedure done, you can read it, and so that for we are giving 33264. So tips for coding, you have to understand the detailed documentation like the use of cardiopulmonary bypass, maze procedure, valve surgery, additional intervention, and which is thoroughly documented. Understand the components, that is whether it is a maze procedure or different types of surgical procedure, and then you have to go through the CPT guidelines, be updated with it. And that's all about this topic. So thank you so much for watching. Go through the examples and read the description of each code. That will help you to clearly understand this topic, and it will be easy for you to code also. Thank you so much for watching. If you haven't subscribed, please do subscribe and share it with your friends also. Thank you so much. Take care. Bye bye.